My name is Shauna LeGrand, and I am the Director of Intensive Level Children's Services for Community Counseling Center. And I am very fortunate to have with me today Dr. Bradley Robison, who will talk to us a little bit about two things that we both share great passion about, which is children and mental health services.
It's good to be with you guys again. Yeah, I'm Dr. Brad Robison. I'm a child and adolescent psychiatrist here in the area. I've been here a lot of years and been working with Community Counseling Center for the last several years with the children's residential services, day treatment programs that we have in several of our schools. And so we're excited to talk about those things and hopefully can provide some insights and information for you that will be helpful for you, for your family, your kids.
I think, when I think about children's mental health and ways to best advocate for our youth, I think about important characteristics or important things that all youth need. Obviously relationships. Relationships are huge. Connection, community, people that believe in them. And so I think at least in my experiences in working with youth, those are some of the core characteristics that make it a real work of art in working with kids. I love working with kids. It's been my passion. I think it's been Brad's passion for many years, which is kind of just a shared vision that we've had. But in working with kids, it does present some unique challenges. Some of the information that we have learned post-COVID, as we're coming out of COVID, is the necessity, the importance of community, of connection with kids. We've seen such an increase in depression and anxiety rates post-COVID. And when looking at some of that, the research through the Journal for the American Medical Association has indicated that there are some key factors that contributed to that. Children needs connection. They need role models. They need community. They need people who are going to look out for them. They need people to provide them some guidance and structure. And when the schools closed, when we all began to have to socially isolate due to COVID, that was a huge piece of the puzzle that was missing for kids. Families lost their jobs. Parents were increasingly stressed as well. So coming out of COVID, we have learned a lot about what it is kids need from what it is they lost during COVID. One of the messages that I would like to get out is, associated with the stigma with mental health. I think that many of us still, unfortunately, have a lot of preconceived notions about what that means. And oftentimes feel embarrassed or ashamed if they are having a child or youth in their family that they feel may need services. And I think this can be a big barrier to seeking out services, and sometimes prevents families and children from getting the support they need. What we know in looking at the research coming out of COVID is that 1 in 5 children struggle with mental health issues. 1 in 5 children. And that's a significant proportion of our community and of our, of those we serve.